Hi, welcome to our Pharma Topics channel. Our topic of discussion is H1 antihistaminic antiemetics. The antiemetic effects appears to be based on anticholinergic, antihistaminic, and antidopaminergic and the sedative properties. Put together, they exhibit the antiemetic property. The drugs in this category are promethazine, diphenhydramine, dimenhydrinate, doxylamine, and cyclizine. All these things they have antiemetic action when compared to the other first generation antihistaminics. H2 second generation antihistaminics does not exhibit antiemetic property. Combination of these antihistaminics with other antiemetics are very useful in chemotherapy induced nausea and vomiting. Doxylamine with pyridoxine is used in combination. It is specifically promoted in India for morning sickness, that is the vomiting of early pregnancy. Sinha, it is an antihistaminic with anticholinergic and antiserotonergic actions. It is an anti-vertigo drug that acts by inhibiting the influx of calcium from the endolymph into the vestibular sensory cells, which mediates the labyrinth reflexes leading to vertigo. So that is blocked by Sinha. So it's a very short information of the H1 antihistaminic drugs which are used as antiemetics. I hope it will be useful for you. If you can easily remember what are the H1 antihistaminics which are used as antiemetics. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel for further updates. If you like this video, kindly press the like button. Thank you.